All right, President-elect Donald Trump has tapped anti-vaccine advocate Robert F. Kennedy Jr. to lead the Department of Health and Human Services. The controversial pick sent shockwaves through the public health world, raising concerns that Kennedy's stance could impact vaccination rates. And now some in the public health community fear that comments Kennedy made during a recent appearance on Fox News suggesting that the wildly popular Ozempic is not going to, quote, make America healthy again, misrepresent the evidence. I'd like to bring in now Dr. Rob Davidson. He is a Michigan ER doctor and the executive director of the Committee to Protect Healthcare. Dr. Davidson, great to see you again.
You as well.
So what are your thoughts on Trump's pick to lead Health and Human Services?
Listen, as a physician for 25 years and talking with my colleagues, people within the Committee to Protect Healthcare, certainly those of us who are advocates on a regular basis, but people I work with who aren't politically motivated, who may be Republican or Democrat or just don't think about it much, are completely shocked by this. We believe this guy is not only unqualified, he's uniquely disqualified to do this job. His views on vaccines alone, his participation in an outbreak of measles in Samoa in 2019, leading to 83 deaths, elevating anti-vax rhetoric in that small population, those are things that just should keep him away from public health altogether.
In the run-up to the election, Trump signaled he planned to let the vaccine skeptic, go wild. That was his words, go wild on health, food, and medicine. Here, in fact, is RFK Jr. talking about his stance in July of 2023.
Can you name any vaccines that you think are good?
I think some of the live virus vaccines are probably averting more problems than they're causing. There's no vaccine that is, safe and effective.
So what kind of impact could that kind of language, have if he's confirmed?
Listen, we already have vaccine hesitancy that was amplified under COVID-19 by folks like RFK Jr. and other groups. They first were out against COVID vaccines, which clearly saved lives. We see absolute discrepancies between folks who followed Donald Trump and watched Fox News and folks who didn't in their uptake and in their survivability after vaccines came on board. But now we're going to have, potentially a mouthpiece of the U.S. government, of the public health infrastructure of this country, spewing things like that. I mean, vaccines have eradicated diseases that I've never seen. I mean, I learned about them in medical school. I haven't seen measles. I haven't seen certain cases of meningitis, epiglottitis. These were deadly diseases. We could have a generation of women not dealing with cervical cancer if HPV vaccines had wide uptake. And with someone like him coming in and spewing nonsense like that, I just fear we're going to go backwards, and he's going to result in a lot of deaths.
Measles, you mentioned measles. Measles cases are surging globally, according to new warning from the World Health Organization and the CDC. And the health organizations point to a drop in vaccinations as the driver behind the rise of a deadly disease the U.S. declared eliminated more than 20 years ago. So at what point, do we need to be concerned, about herd immunity, especially as it pertains to measles and other things that people have been vaccinated against in recent years?
Yeah, I think we should be concerned right now. I think, myself, folks within this organization, were mobilizing doctors across this country, tens of thousands of doctors, to come out and speak out against this nomination, out against RFK Jr. having any hand in public health. And we're going to mobilize doctors to talk with folks in their community, to talk with their senators, to push back against this. This is where we have some power, we have knowledge, people trust us, our patients trust us. They should not trust him, and he should be nowhere near those levers of government.
So what will it be like for you and others in the medical community if indeed he is confirmed, or by recessed appointment, he becomes the next director, secretary of?
Listen, the fight for our patients never stops. We are all advocates on a daily basis for what our patients need. We'll continue to do that. We will continue to speak to our patients about the necessity of vaccines, continue to speak out publicly against any objectionable language he brings out or policies that he puts forth, and hopefully, can convince the wider world of healthcare, which is on the side of vaccines and of science-based medical practice, convince those folks to continue to do what we need to do for our patients. if there are doctors out there watching, please go to committeetoprotect.org and join us in this fight, because we just can't get to that point. We don't want to have to do all of that fighting all of the time just to take care of the folks we know how to take care of.
All right. With Dr. Rob Davidson, thank you so much. Thanks for being on with us and always talking about and advocating for the fight for our best health. Appreciate it.
Thanks, Brett.